When it comes to health risks, two of the most feared and prevalent conditions worldwide are heart disease and cancer. Both diseases have long been studied separately, but emerging research is suggesting an interesting link between the two. Recent studies indicate that those who suffer from heart disease may also be at a higher risk of developing cancer. This connection has raised many questions about the common factors that may contribute to both conditions. Let's dive deeper into the intriguing relationship between heart disease and cancer, and explore how these two major health issues might be interconnected. Common risk factors. When we consider heart disease and cancer, both are life-threatening conditions that are often discussed separately, but they share several common risk factors that can make an individual susceptible to both diseases. These factors are not only a matter of genetic predisposition, but are also heavily influenced by lifestyle choices. Smoking, poor dietary habits, lack of physical activity, and excessive alcohol consumption are some of the most significant contributors to both heart disease and cancer. Smoking is one of the most well-documented risk factors for both conditions. The harmful chemicals in tobacco smoke damage the cardiovascular system by promoting plaque buildup in the arteries, which leads to atherosclerosis. This can eventually result in heart attacks, strokes, and other forms of heart disease. But smoking doesn't stop at harming the heart. It's also the primary cause of lung cancer and is linked to other cancers such as throat, mouth, and bladder cancer. The toxic substances in cigarettes can cause cellular damage and genetic mutations, increasing the likelihood of cancerous growths. 2. Inflammation as a common factor. One of the key factors linking heart disease and cancer is inflammation. Chronic inflammation has been identified as a major player in the development of both diseases. In heart disease, inflammation in the arteries leads to plaque buildup, which can result in heart attacks and strokes. Similarly, inflammation is a critical factor in cancer, as it can cause DNA damage, promote tumor growth, and support the spread of cancer cells. Inflammatory markers, such as C-reactive protein (CRP), are often elevated in individuals with heart disease and cancer, suggesting that inflammation may serve as a common underlying factor in both diseases. 3. The role of obesity. Obesity is another significant risk factor that links heart disease and cancer. Excess body fat, particularly abdominal fat, has been linked to an increased risk of both conditions. Obesity contributes to the development of heart disease by increasing blood pressure, cholesterol levels, and the risk of type 2 diabetes. At the same time, excess fat tissue produces inflammatory molecules that can promote the growth of cancer cells. Studies have shown that people with obesity are more likely to develop certain types of cancer, including breast, colorectal, and prostate cancer, as well as cardiovascular disease. This suggests that the biological processes triggered by obesity may be fueling both heart disease and cancer simultaneously. 4. Genetics and family history. Another possible explanation for the link between heart disease and cancer could be genetics. Individuals with a family history of heart disease or cancer may be genetically predisposed to both. Certain genetic mutations or inherited traits can increase the likelihood of developing cardiovascular disease and cancer, as these conditions share some genetic pathways. For instance, mutations in genes that control cell growth and repair may lead to both increased susceptibility to cancer and higher rates of cardiovascular disease. Understanding these genetic predispositions can help healthcare providers better assess and manage the risks for individuals with a family history of these diseases. 5. The impact of stress. Chronic stress is a factor that can contribute to both heart disease and cancer. Stress triggers the release of stress hormones such as cortisol, which over time can have detrimental effects on the body. In the case of heart disease, chronic stress is known to contribute to high blood pressure, arterial damage, and unhealthy behaviors like overeating or smoking. Stress also weakens the immune system, making the body more vulnerable to cancer. Research suggests that prolonged stress may encourage the growth of tumors by altering immune function and promoting inflammation. By managing stress through healthy coping mechanisms, individuals may reduce their risk of both conditions. 6. Hormonal influences. Certain hormones can play a role in the development of both heart disease and cancer. For example, estrogen is a hormone that has been linked to both breast cancer cancer, and cardiovascular health. High levels of estrogen, particularly during menopause or as a result of hormone replacement therapy, may increase the risk of breast cancer while also affecting the cardiovascular system. Similarly, testosterone has been implicated in prostate cancer and may have an impact on heart health as well. Hormonal imbalances or prolonged exposure to certain hormones may therefore contribute to both heart disease and cancer, particularly in individuals with a genetic predisposition to these conditions. 7. The role of medications. Interestingly, some medications used to treat one condition may increase the risk of the other. For example, certain medications used to manage heart disease, such as statins and blood pressure medications, have been found to lower the risk of some cancers, particularly colorectal cancer. On the other hand, treatments for cancer such as chemotherapy can damage the cardiovascular system and increase the risk of heart disease. Understanding the relationship between these medications and their potential effects on both conditions is crucial for healthcare providers to ensure that patients receive comprehensive care that addresses both their heart health and cancer risks. 8. Lifestyle changes for prevention. Making lifestyle changes is one of the most effective ways to reduce the risk of both heart disease and cancer. Regular physical activity, a balanced diet, weight management, and smoking cessation are all important steps in lowering the risk of both conditions. Exercise, for instance, can help improve cardiovascular health while also lowering the risk of certain cancers by enhancing immune function and reducing inflammation. A healthy diet rich in fruits, vegetables, whole grains, and healthy fats supports heart health and may help protect against cancer. Reducing alcohol consumption is also crucial, as excessive drinking increases the risk of both heart disease and several types of cancer. 9. Screening and early detection. Early detection plays a critical role in managing both heart disease and cancer. Regular screenings for heart disease, such as cholesterol checks and blood pressure monitoring, can help catch potential problems early, allowing for prompt intervention. Similarly, cancer screenings such as mammograms, colonoscopies, and prostate exams can help detect cancer at an early stage when it is more treatable. Individuals who are at higher risk for both conditions should work closely with their healthcare provider to develop a personalized screening plan that can address both heart disease and cancer risks simultaneously. 10. The future of research. As research into the link between heart disease and cancer continues, we are learning more about how these diseases might be connected. Advances in genomics, immunology, and lifestyle medicine are helping scientists uncover new ways to prevent and treat both conditions. Understanding the shared mechanisms behind heart disease and cancer could lead to more targeted therapies that address both diseases simultaneously. As we gain more knowledge, we may find innovative ways to prevent, treat, and even reverse the effects of both heart disease and cancer. The connection between heart disease and cancer is becoming increasingly clear, with shared risk factors, genetic predispositions, and lifestyle influences all playing a role in both diseases. While the link between these two major health conditions requires more research, there is no doubt that making healthy lifestyle choices, such as exercising, eating a balanced diet, and managing stress, can significantly reduce the risk of both. By taking proactive steps to protect heart health and reduce cancer risk, we can improve our chances of living a longer, healthier life. It's important to stay informed, undergo regular screenings, and work with healthcare providers to manage risks effectively. If you found this information helpful, don't forget to hit the subscribe button for more health tips and insights. Stay healthy and take charge of your well-being.